Hello champions, welcome to another PHA class with Mr. Bello. In today's lesson, I will be teaching an enlightening topic known as female genital mutilation. In this topic, we will be learning a lot of things that will be eyes-opening. In this lesson, we'll be learning the external parts of the female genital system, the meaning of female genital mutilation, types of female genital mutilation, reasons for female genital mutilation, and health consequences of female genital mutilation. What is the meaning of female genital mutilation? It is said to be the removal by surgery of a piece or a major part of the external sex organ of female. According to World Health Organization, the female genital mutilation is said to be comprised of all the procedures that involve partial or total removal of the external genitalia or other injuries to the female organ. Now let's take a good look at the parts of the external female organ. The external female organ comprises of the vulva, and this vulva is the external part that comprises of the mons, the labia, the clitoris, urethra, and the orifice that is also known as the vaginal opening. The mons is the soft upper part of the vagina or vulva that covers the pubic bones and carries the pubic hairs. The clitoris is the small organ that is located in the soft fold in the upper part of the vagina. The hymen is a thin membrane that partially covers the vaginal opening, also known as the orifice. The labia minora, they are the inner left and right lips that cover and protect the urethra and vaginal opening. The labia majora, this is the outer left and right lips that provide additional protection in addition to that provided by the labia minora. The orifice is also known as an opening, that is the vaginal opening. And the urethral opening is a small opening that is between the clitoris and the orifice. Having known the meaning of the female genital mutilation and the parts of the female genitalia, let us now proceed to the types of female genital mutilation. When a newborn baby is born, that is female, or when they are of age, a significant part of their genital system is removed. But the degree to which this cut is made determines the type of female genital mutilation. So female genital mutilation are broadly classified into the following, depending on how deep the cut is. There is type 1, known as clitoral peeling, type 2, excision, type 3, infibulation, type 4, Kishiri cut, type 5, vaginal piercing, and type 6, others. The type 1, clitoral peeling, is the removal of the skin that is covering the clitoris, also known as prepuce. Right on the spot, the covering of the clitoris can be taken off or the entire clitoris taken off. This is the mildest form of genital mutilation. Type 2, also known as excision. Excision is the removal of the clitoris and the upper parts or all the minora, that is the inner lips of the vulva. This form of genital mutilation, that is the type 2 and the type 1, are very common in Nigeria. Type 3, infibulation. Infibulation is the removal of the clitoris and the entire labia minora. Then the labia majora, which is the outer vaginal lips, they are then sewn together, then leaving a very small hole for urinating and menstruating. This form of genital mutilation is the most severe form of genital mutilation. If it is sewn together, in the future when the female marries, it can be loosed. Type 4, the Kishiri cut. This involves cutting which extends from the vaginal opening in front or behind into the surrounding tissue with damage to the urinary bladder, urethra, and rectum. This is particularly common during childbirth. It is done in the female genitalia to enhance the birth of a child when the woman delivering is having problem or difficulties delivering. Type 5 is known as the vaginal piercing. This type of female genital mutilation involves cutting a hole in the clitoris, then a jewelry is inserted. This is particularly carried out for the sake of attraction. Type 6, also known as orders, and these include the likes of scraping of tissues around the vaginal entrance, stretching of the clitoris, dilation of the vagina, and introduction of corrosive substances such as alum, herbs into the vagina. This is carried out among some persons. Now, what are the reasons for female genital mutilation? This female genital mutilation in children is particularly done for the following reasons. The first one, social reasons. Some people do it because they see others do it. This is particularly carried out among some tribes. In some societies, the female child cannot function with their peers if they are not circumcised. Now, cultural reasons. Some cultures aim to show that the girl child has attained maturity or womanhood by circumcision. Also, to prevent promiscuity among female children. Another one is vaginal attraction. People who do it, some also do it in pursuance of vaginal attraction. Then prevention of excessive clitoral growth. It is believed that the female with increased clitoris will be more sensitive to sex and therefore promiscuous. This are not medically proven, but that is some of the belief that the society holds. Enhancement of fertility. In some society, it is a general idea that the woman that is circumcised will have the fertility improved. Lastly, preservation of virginity. This is to prevent the girl child from being deflowered early and also to increase their opportunity of getting married. Let's take a look at the health consequences of female genital mutilation. The female genital mutilation is not allowed in any recognized hospital, clinic, or maternity. So most of the practices they are done locally by native doctors, traditional birth attendants, and local barbers. They use unsterilized special knives, sharp stones, glasses, or blades, and these practices result in the following consequences. The first one is surgical shock or pain. The surgical shock or pain that the victim gets during this process is great, as when these things being performed, they do not use anesthesias on the people. Aside that, there is bleeding and infection. You see, the victim bleeds a lot and in the process can be contaminated with some infection or the other. Also, there is urine retention. When it comes to urine retention, the circumcised female child is unable to pass out urine for some time. It could be a day or two, and this retention of urine causes infection to the victim. There is delay in wound healing. And this can lead to pelvic infections such as abscesses, painful sexual intercourse, and regular bleeding, which is not comfortable for the girl child or woman. There also tends to be lack of sexual pleasure, since the female experiences some cut in the genitalia during the process of circumcision. The female tends to experience pain, especially during sexual intercourse. And aside that, there is difficulty in childbirth. Due to the cuts that I experienced during the operation, the female experiences pain in those spots during childbirth. Stillbirth or brain damage of the baby. Due to delay labor during childbirth, there tends to be a damage to the brain of the child, or in some cases, even results to a stillbirth, that is, a dead baby. After delivery effect is another one. You see, the female suffer from vesico-vaginal fistula due to prolonged or obstructed labor as a result to the female genital mutilation process. Okay, lovely students, we have come to the end of this lesson. Proceed to the quiz section and have a nice day.